In this video, we will be going over delegation. We will review task delegation to different members of that nursing team, the registered nurse, the licensed practical nurse, and the unlicensed personnel such as the CNA or technician. We will be going over 5 questions. For those listening, I will read the question, then pause to give you a second to think of what you remember. Then I will read the choices and we will discuss. Before we start, I wanted you to take a look at this picture. I really like it because there's 3 people here and they're all looking at the same clipboard. And that is really the picture of what we should be thinking too. This is team nursing, and technically the 3 members of the team should all be caring for the same patient. Now, I've worked agency for almost 2 decades and I will tell you I've never had the opportunity to be assigned like this, but on the test, this is the way they envision it. The RN has roles with that patient, the LPN has roles with that same patient, and then so does the tech. So if you can kind of see it that way as a team like that's pictured, it might help you in these questions. Let's get started. Question number 1. The charge nurse is making an assignment. Which of the following patients should be assigned to the LPN? Try to think about what you remember about their role and the tasks they can do. Is it number 1, to take care of a patient receiving 3 runs of potassium IV? Number 2, a patient on a nitroglycerin drip? Number 3, a new admission? Number 4, a patient status post-amputation requiring follow-up teaching on his dressing change? The answer here is that the LPN can take care of number 4. We have to remember that LPNs, if you think of an overriding concept, they can do anything that's a repeat procedure, like repeat meaning the RN has already done it for the first time and they're kind of following up. Or they can do anything that's a sterile skill, such as suctioning, inserting a Foley. Just think of anything requiring sterile gloves. So in this question, the trick is to remind yourself that just because it says teaching, it doesn't necessarily mean an LPN can't do it. There's some schools that will teach that. This is follow-up teaching, so it doesn't indicate that the LPN is teaching something new, and that's why number 4 is the answer. This is a little hint that I developed years ago for delegation. I feel like students get an overwhelming list of things that each team member can do, and I'm all about making things simple. So my delegation hint is called 3-2-1. If you can remember that RNs do 3 main things: anything that would be considered first time, anything that's too acute, like the 3 runs of potassium, that means somebody's electrolytes are going crazy, that drip, that's somebody that's too acute, unstable, and then finally IV push. LPNs are allowed to give meds, but they can't do IV push. If you can remember that the LPN can do 2 things, they can do anything like I mentioned a second ago, repeat, like following up, anything in the nursing process that's following up what the RN has already done, and then there's sterile skills. And then finally we have that tech. This question didn't involve the tech, but it goes along with our hint that techs or CNAs can do any clean tasks, so things that wouldn't require them to put on sterile gloves, but they have to not require nursing judgment. Nursing judgment is, clinical judgment or the nursing process. It can't involve any kind of critical thinking. So hopefully that helps, and take a screenshot if you need to. Write down that hint. I've been teaching that to students forever and they really like it. Hopefully that simplifies delegation. Let's go on to the next question. 2. Which responsibility should the nurse direct the technician to carry out? Is it number 1, a patient with a lower GI bleed that needs his commode emptied? Number 2, a patient who needs to have deep breathing done? Number 3, an asthma patient who is on 2 liters of oxygen and needs his oxygen increased to 3 liters? Or number 4, a diabetic whose blood sugar is 60, ate 20% of breakfast and needs some orange juice? The thought here, if you wanted to remember from the last slide, is to think delegation 1 thing. The overriding idea is that techs can do anything that's a clean task but does not require nursing judgment. So the answer is number 1. Be careful here. Don't get caught in that distractor number 1. It does mention the client's diagnosis, but if you look at what you're delegating to the tech, it's to empty the commode. Don't add any information here. It doesn't say to assess what's in there. It just says empty the commode. Numbers 2 and 3 are interventions. Those should not be delegated. And number 4 is also an intervention. That orange juice is an intervention for the blood sugar, and therefore you can't delegate that. Be careful with some of the questions that look like they're no big deal, but they actually are. Those answers can be a little bit tricky. Like I've seen one that says, should you delegate an Alzheimer's patient who's being non-compliant? Should you delegate that bath to the tech? And the answer is no, because that would require some nursing judgment to figure out how to bathe that client. So read these carefully. Some of them can be a little tricky, but hopefully you don't get caught. 3. Which of the following is appropriate delegation? Select all that apply. So we're going to try to remember that 3, 2, 1. And I included pictures here. Sometimes pictures are worth 1,000 words, right? That top picture shows that RN there, running that client to wherever they're going. That client's acute. The RN needs to be there. The middle picture is that LPN following up on a patient. How are you doing today? Is there anything you need? Repeating what the RN has already taken care of and, stabilize that patient. And then in the bottom is your tech, those tasks that they're assigned to do. In this case, it's walking this client down the hallway. So let's see how we do with this. Which of the following answers would you pick as appropriate delegation? Is it number 1, an RN taking an admission? Number 2, an LPN answering call bells? Number 3, a tech taking vital signs? Number 4, an LPN emptying a bedside commode? Number 5, an RN suctioning a patient? And or number 6, a tech starting a tube feed? Remember, this is select all that apply. Okay, hopefully you made your choices. Let's go true, false. Number 1 is true. That fits in our idea of 3 things, is particularly that new admission, so that's true. Number 2 is false. Be careful here. This isn't about what somebody can do on the floor to help. It's what they should be delegated or assigned to do. An LPN should not be assigned to sit there and answer call bells. That should be the unit secretary or a technician, CNA. So if you look at through those eyes, maybe you change your mind a little bit. Number 3 is true. The tech should be assigned to take the vital signs. Number 4 is, again, false. You should not assign an LPN to go around emptying the bedside commodes. That should be the CNAs. So can an LPN empty the commode? Yes, but that wasn't the question. The question was what should be delegated to the different team members. So you have to remember that 3, 2, 1 hint. Number 5, the RN should not be delegated to go around suctioning the patients. That should be the LPN. That's the sterile technique. It doesn't say the client's acute here. And then in number 6, that is false too. The tech should definitely not start a tube feed. That should be the RN. If it's a new tube feed, repeating the tube feed could be the LPN. So the only answers that are true here are numbers 1 and 3. If you remember that 3, 2, 1 delegation, maybe kind of make a mental picture of the visuals I have on this slide for you, if that helps as well. And so you have to remember here, we don't over delegate. I think we're very cautious about that one. But you also have to remember, don't under-delegate. Keep them assigned to the appropriate tasks that they should be doing. Question number 4. A charge nurse, RN, must determine how best to assign coworkers, another RN and 1 licensed practical nurse, LPN, to provide care to a group of clients. Which of the following is the appropriate assignment? Is it number 1, the RN is assigned to care for an unemployed 26-year-old woman newly diagnosed with acquired immunodeficiency syndrome or AIDS who has 4 school-age children? Number 2, an LPN assigned to care for a 41-year-old male post-resection of an acoustic neuroma 2 days ago who was transferred from the ICU unit, the intensive care unit, this morning. Number 3, the LPN is assigned to provide discharge teaching about medication and maintenance of nephrostomy tube to a 35-year-old man. Number 4, the RN is assigned to care for a 65-year-old woman hospitalized because of chest pain being discharged today to home with no medications? The answer here is number 1. If you remember the 3-2-1 thought, number 1 fits with our first time teaching, newly diagnosed. We're going to quickly go through the other 3 and say why these are not appropriate. Number 2, that client was just coming from the ICU. I think we'd rather give it to the RN first, make sure they're stable. Number 3, this one implies that there's new teaching going on, teaching about medications and the maintenance of the nephrostomy too. That'd be better assigned to the RN. And number 4, in this one, the client's being discharged, but it makes clear that there's no new medications, and therefore the RN doesn't need to do this discharge, the LPN can. It's simply go in, do you have any questions? Because remember, teaching should start on day 1. Do you have any questions? No? Okay, here, sign. That doesn't need to be the RN. So make sure that you definitely review your task delegation and try out 3-2-1 on other questions, and hopefully it helps you too. Number 5. A nurse is reviewing with a nursing assistant the care assignment for a client. Which of the following statements made by the nurse regarding care of a client with crutches is most appropriate? Is the answer number 1, the client needs to ambulate with crutches and a 2-point gait? Number 2, ambulate the client with the crutches to avoid weight bearing every 4 hours the length of the hall and back. Number 3, ask the client if she understands how to use a 2-point gait. If not, explain it to the client. Number 4, make sure the client does not bend the elbows when using the crutches. The answer here is number 2. I really like this question. It's a good reminder to pay attention to who you're talking to. If you're talking to the nursing assistant, remember, we delegate the task, but no nursing judgment. So we should just simply be saying, hey, when you ambulate the client, make sure they use their crutches and ambulate them every 4 hours. There should be no discussion about this 2-point gait, making sure if the client understands, make sure they're not bending their elbows. That's all nursing judgment. The nurse needs to have checked all that out before telling the nursing assistant to ambulate the client. So number 2 is the nursing assistant's role. And we just have to be careful. If you're stuck, maybe that's why you're stuck. Go back to the question, make sure you really understood it. Who are they talking to? Pay attention to that. And then think of what is appropriate for that person you're speaking to. What is appropriate for that audience that you have in the question? For example, if this said reviewing with the patient, that would make the answer different. Which one do you think the answer would be if it said you're reviewing with the patient? That would have been number 3. When reviewing with the patient, you have to first assess to make sure if they understand, and then if not, you could explain it to them. So, little trick, pay attention to who you're talking to. So that's it, a few questions on delegation. Hope that helps strengthen your ability to decide which team members can do what. If you like this content, please subscribe to our channel, and please like this video, and you can find us at signstrategies.com.